Hello, welcome back to the channel Informal Training Solution. So today's topic will be suppositories. Now, of course, suppositories are intended to be inserted into the body orifices where they melt, soften, or release the active drug. Now, of course, they are intended for either internal, so they are intended for systemic or even local action. Of course, we know they are torpedo shaped to enable them to be inserted in the rectum. Of course, we have also suppositories to be used by ladies. These are globular and oviform and cone shaped. Now, which are those advantages of the suppository form? Of course, they can provide local or systemic action. Now, in systemic action, the amount is used in those patients who are vomiting or who are unconscious. For example, the antimalarial artesunate. Artesunate, it is used for systemic action. We have paracetamol suppositories, even the diclofenac suppositories. These can be used for as an analgesic. Of course, the effects is not local, but it's systemic. However, local effects, we have the hemorrhoidal and those ones in the ladies, especially the antifungal and the what. Of course, we can avoid GIT irritation because drugs are not used through the GIT. There's also avoidance of fast pass effect if it is inserted very well. However, with the suppositories, disadvantage is low rate of absorption from the base, and also some patients feel discomfort while suppositories are inserted, and very many other advantages which you have. So let us look at absorption from the rectum, because these veins which take drug away from the rectum. We have the lower or inferior hemorrhoidal vein, straight to the general saturation. Of course, you are avoiding first pass effect. The middle hemorrhoidal vein, again, you are avoiding first pass effect because it goes straight in the general saturation. However, if you start it further, it can be taken into the liver via the portal vein, and of course, once this happens, it means that the drug can have first pass metabolism, because it can be metabolized before it reaches the general saturation. Which factors can affect rectal absorption of the drug? We have physiochemical properties of the drug, nature of the base, particle size. Because if the particle size is bigger, it can affect the drug absorption. We have the quantity of fluid. However, most of the suppositories can melt in low fluid content, because we know where they are inserted, the fluids are not so much, and of course the content is the rectum. That's why it is advisable for patients to either drain the bladder or the rectum before use of the suppository, because you imagine just before, after just inserting them, the patient requires to go for other duties. What will happen? The drug will be expelled. Of course, what are suppository bases? Of course, all API and drug and other excipients are incorporated into a base called suppository base, because this is the vehicle for the drug. Of course, a suppository base is meant to melt at body temperature and release the drug. Of course, now the suppository base should be compatible with the medicament. However, it should be able to release the medicament. Because imagine you insert your suppository base you insert your drug in the base where the drug has more affinity to the base. Of course, you want to be absorbed in the rectum or via other means. Also, the base should be non-toxic, non-irritant, and of course should be, the cost should be cost effective. Which are those examples of the bases which are used? We have fatty bases, we have the cocoa butter or the theobroma. However, it can undergo polymorphism. Of course, you know this one. It can change shape inside. And the other advantages which you have in your note, the synthetic fatty bases, we have the Suppository, white soap, and others. Of course, this has an advantage, and also this. Let me underline it. This and this. They have advantages and disadvantages. This and this, and then have the water miscible, and all the other, the soap gelatin and all the others. Remember, this is a short presentation, and you can get more of this. However, if you can't get more, you are always available for discussion. Of course, other arrangements. How do you prepare suppositories? Of course, they are prepared using the molding method. We have the pour molding or compression molding, and this automatic and focus found in the industries, which can be semi or auto. Of course, the base is heated above melting point over water bath in an evaporating dish, and the API is incorporated. Even other excipients can be incorporated and steered to near cool. And of course, then the molten product is poured into molds, of course, in excess. After settling, you trim off, and then you remove from the cavities, and then you pack. Of course, the molds can be made of stainless steels, are the common ones we have in schools. Also have plastic ones, which are single use. These are plastic ones are single use. However, all molds, it's important to first calibrate the mold before use. All this calibration also has its own steps. Let us talk about lubrication, because lubrication is important for elegance, because if you don't lubricate, the product will stick and it will cause surface depression. So of course it will be non-elegant. So it's important to lubricate the mold cavities. And how do we lubricate? In case you're using cocoa butter as a base, you use soap spirit, or if you're using water miscible bases like soap gelatin base, you use liquid paraffin. As of course, all these are steps. I wish you had means we could show you. I'm sure with the time, as the year goes on, we may get means on how we can show you all this and how it is. Displacement value, of course, all calculations in suppository should be done in excess, because why excess? When you are pouring in the mold, you pour or you overfill, and you have to trim off, and it may stick in the container, the evaporating dish. So you meant to withdraw all. And also, of course, building incorporation into the molten base, since the drug has density, it may displace some of the base. Now, the basis for displacement value. Now, what is displacement value? Of course, it's defined as the number of parts by weight of the ingredient that displaces one part of theobroma oil, because we use theobroma as the standard. For example, if zinc oxide has this DV of 4.7, it means that 4.7 grams of zinc oxide will displace 1 gram of theobroma. Now, there are calculations which I have not gone through, and these calculations are very important to know them. How to calculate the displacement value, how to calculate the working formula, how to do all those. In case you have them, it is okay, or you can contact us, or you can go to books and then you read more. Now, packaging. Of course, packaging, after preparing, you have to package. Of course, those ones in the pharmacies, they are packaged in an elegant way. Of course, you know how they are packaged. However, in our schools or laboratories, how we teach you that, they are packaged by wrapping in aluminum foil, and of course, we place them in jars. Labeling, of course, it should have a standard components of a label, and also it should have indicate clearly for rectal or vaginal use. And of course, I will tell the patient to unwrap before inserting. Sometimes they can dip in water, or they can first leave it in air for some small time and then insert. The number of times and at what time, and ensure you tell them at least first empty the bladder or the rectum before use. It's very important, because if you don't, something. And other counseling techniques. This has been a short presentation on suppositories. I always remain Wilson. It has been brought to you by Informal Training Solutions. Subscribe to our channel In case of anything, you can contact us. We shall always reply. And thank you very much.